This is 97.7 The Bolt, and it's Tuesday, which means that it's time for the Humboldt County Memorial Hospital Your Care, Our Mission show. And this morning I am joined by Katie. So good morning, Katie.
Good morning, Emily. Thanks for having me. I'm Katie Legvold, and I'm an occupational therapist and a certified lymphedema therapist with Humboldt County Memorial Hospital. And I'm very excited to share with our listeners that the rehab department is now able to offer lymphedema treatments right here in Humboldt. So my goal this morning is to provide a little bit of education on what lymphedema is and how it can be treated. So what I've found is that many people don't even know what lymphedema is until they're diagnosed. Lymphedema is a swelling in the body, which can occur in the limbs, the trunk, the abdomen, or the face. Lymphedema results from a protein-rich fluid which accumulates in the superficial tissue. That's different from just what we call edema, which is just fluid. It's not that protein-rich fluid. So this can cause significant changes to your body if it's left untreated. So when lymphedema is present, it requires some intervention and really lifelong care. So what causes lymphedema? There's actually two kinds. The primary lymphedema is actually a malformation of the lymphatic system that a person is born with, so it usually presents at a young age. And then there's secondary lymphedema, which occurs when a healthy lymphatic system becomes injured or damaged somehow. Cancer treatments like surgery, radiation, removal of lymph nodes, even severe circulatory insufficiencies, trauma or infection can damage the lymphatic system, which will result in lymphedema. So in the U.S., breast cancer surgeries and treatments are actually the number one cause of lymphedema.
Okay.
So what does lymphedema look like? Well, initially it may just be some swelling that kind of comes and goes, but over time, that accumulation of the protein-rich fluid will cause the skin and the tissues to harden or become fibrotic. So as the swelling progresses, our skin can't receive the necessary nutrients, so it becomes unhealthy and increases our risk for infection. So, and if you see swelling in, for example, both legs, it usually looks asymmetrical. So that's kind of just an overview of what lymphedema is and looks like.
All right, so much information taken. Let's take a little break here on 97.7 Volt, and we'll be back with the Humboldt County Memorial Hospital Your Care, Our Mission show.
The mission of Humboldt County Memorial Hospital is to serve with compassionate care in a patient-centered environment. Humboldt County Memorial Hospital is preparing for the future healthcare environment by working with community physicians and by networking with local and regional healthcare partners. Dr. Vladimir Donchev, general surgeon, specializing in laparoscopic gallbladder removal, hernia repair, removal of lesions, just to name a few, right here in Humboldt. What is laparoscopic gallbladder removal? Laparoscopic gallbladder removal is a minimally invasive surgery in which small incisions and specialized tools are used to remove a diseased or infected gallbladder. Please call Humboldt County Memorial Hospital Surgery at 332-7669 for any questions. Humboldt County Memorial Hospital, quality care close to home.
This is 97.7 The Bolt, and we're back here with the Humboldt County Memorial Hospital Your Care, Our Mission show, and I'm joined by Katie, and she is talking about lymphedema. Did I say that right?
Yes.
All right, and so how do we treat this disease?
Well, so lymphedema is that protein-rich fluid that accumulates, so we get some swelling. So how we treat it, if you come into the clinic and see me, we treat it with a 4-part process, which we call complete decongestive therapy. So the goal for the treatment is to reduce the swelling and then maintain that reduction for life. Part 1 is just skin care. We want to make sure the skin's healthy and the integrity stays intact and reduce the risk of infection. Part 2 is called manual lymph drainage, which is gentle manual treatments. It's not massage. A lot of people think it's massage, but it's just a manual treatment that's actually used to activate the lymphatic system. It's very light and superficial, and it assists to manually move fluid from an area with the damaged lymphatics to an area where there's healthy lymphatics, which can then remove that excess fluid from the body. Part 3 is compression therapy. We do a gradient of compression that goes from the most distal, or for example your toes, up to a more proximal area, your thigh, which is used to prevent the reaccumulation of fluid. So once we move some fluid out, we want to make sure we don't just gain it all back in. This also increased the effectiveness of what we call muscle pumps when we exercise. So that compression is applied by bandaging initially during initial treatments, and then once we reduce the size of the affected area, we can then use compression garments, which is what typically people wear for their lifetime when they're just doing their regular activities. And our fourth and last part is exercise. So an exercise program is provided, and that aids in the effectiveness of those muscle pumps that we talked about and maintains that reduction that we get through therapy. So our muscles help squeeze on our lymphatic vessels, and they move fluid as they contract. Finally, I just want to mention some precautions with lymphedema. We advise avoiding any blood pressures, injections, or venipunctures during or done on the affected limb. And we also avoid any injuries to the skin, which even includes bug bites, razor cuts, and tight-fitting clothes. This goes back to that swelling that makes it difficult for nutrients to reach the skin, so it causes a very fragile and susceptible environment for infection. And overall, I'd just like listeners to know that lymphedema is manageable and treatable, and now we're able to do that right here in Humboldt at the Humboldt County Memorial Hospital in the rehab department, where you are always our priority. So for anyone seeking treatment or having concern regarding any unusual swelling or edema, contact your doctor. And then once your doctor has determined the problem or has figured out what they recommend, they can refer you on to us for any therapy services that you might need.
All right, awesome. Again, that is Katie with the Humboldt County Memorial Hospital here on the Your Care, Our Mission show on 97.7 Volt. Thank you for joining me.
Thank you, Emily. Appreciate it.